This is the definition of a crisis. Today we toured the constituency of Northeast St. Andrew, Delroy Truck being the Member of Parliament, and we are now in Central Kingston with Member of Parliament Donald Williams. In Northeast St. Andrew, we saw the first mobilized community COVID-19 vaccination ambassadors. We met with approximately 40 of them. Minister Truck explained that he has hired 60 overall. He is going to take on the cost for the additional 20 because he feels it's such an effective way of getting out into the communities, getting the information to people where they are and having that one-on-one conversation which people actually need. There are many reasons why persons are not taking the vaccines, and having the conversation sometimes helps to resolve some of the skepticism, the fear and the lack of knowledge. So I'm very hopeful that the community mobilization will reinforce the national message that is being put out by the Ministry of Health and generally by the government of Jamaica.
Prime Minister, what do you do? Two quick questions, Prime Minister. Let's start out with the mu, if I'm pronouncing it correctly.
Mu, the potentially new variant.
Right. We have seen where St. Vincent and the Grenadine has tested and found that there are at least 5 cases. So it's actually in the region. Your administration had said some time ago that you would be acquiring the genome sequencing machine to be able to test for variants. Where are we now with that? That's the first question. And secondly, as you would be aware, Mr. Prime Minister, the public defender and the parliamentary opposition recently called for an independent inquiry into alleged deaths as a result of the oxygen shortage about a week and a half or so. Could you tell me if your administration would support this move?
Well, let's deal with the new variant.
Right.
As I said at my press conference that we're watching this new variant. The genome machine should be in the island very shortly. I'm very disappointed that it has not been. We announced this in April. But the procurement process is one that we cannot avoid. You know, there are those who hold the view that we need to do all that we need to do now because it's an emergency. What the technical people tell us who have to deal with these things is that after the emergency, they are the ones who will face the parliamentary committees, the public embarrassment, and possibly be prosecuted. So they are following the law, they're following the rules, and the government can only support and endorse that. We ask that they move as quickly as possible. So the genome sequencing machine should be here shortly. It's going through that process. And hopefully we will have it. That does not, however, prevent us from doing the tests to ensure that we are aware of what kind of virus is here. As it relates to the deaths that have occurred, let me say that it is quite unfortunate. And I've been following very closely the situation with the nurses, but the hundreds of Jamaicans who have passed and their family members. The situation with the oxygen, based upon the reports that I have received, would have been caused by a force majeure event, meaning an event that was beyond the control of the suppliers. Let me just be clear that Jamaica is not the only country that would have had situations where our oxygen supplies would have been challenged. Now, any death must be properly investigated. That is the law of the land. And I'm certain that the Ministry of Health and the relevant authorities are investigating all the deaths that have occurred. I am awaiting a report on the deaths that have occurred for me to see the official determination. One of the challenges, of course, is that many of the persons who would have unfortunately passed would have also had comorbidities and other issues underlying. So there has to be definitely an investigation into identifying what actually was the cause. So I would await that before I make any further pronouncement. This is the definition of a crisis. A crisis situation is one in which the resources that you have at your disposal are stretched and not sufficient to address the challenge that you have at hand. And we have to work as best as possible with limited resources that we have, even resources that are challenged, even resources that are subject to force majeure, to ensure that as quickly as possible we bring the resources to deal with the challenge. And in the oxygen challenge that we had last week, it is clear that the government responded very quickly to ensure that whatever shortages there were, they were immediately addressed. When I announced that I would be going on a national tour, I, in the same breath, announced that I would be consulting with the leader of the opposition to see how we could integrate our efforts towards a national vaccination campaign. Before the first tour took place last week, I noticed a video being circulated of party paraphernalia on a vaccination site. I was appalled, and I immediately intervened, and I put out a very strong rebuke to such action. The national campaign is absolutely not a political effort. Now, we took a risk, but we thought it a necessary risk, that in engaging the national effort, in engaging the church, in engaging the private sector, in engaging the JDF, in engaging the entertainment sector, we also thought that it would be a useful effort to engage the political machinery of the political parties. Because we do this for every election. We go around, we go to people's homes, we knock on their gates, we canvass them, we encourage them to come out and vote. Why not use that vast machinery for a national good, such as vaccines? The political parties have a broad worker base. Every constituency would have 1,000 or more workers, not to mention members. So we thought it would be good to reach out to the political parties and say, use your political machinery as well in this national effort. The risk with that is that some people are always going to misinterpret the intention. So I'm glad you asked the question to give me the opportunity to make it absolutely clear to my own supporters and to the supporters of the PNP that this is not a political effort. This is one time in which we can all mobilize for the national good. Your second question was on whether or not the cabinet was considering closing our borders to persons who are non-national and not vaccinated. We have not yet contemplated. As you know, there is this balance between lives and livelihood. And you could imagine that it would have a massive impact on our economy because Jamaica is so much integrated into the regional economy. Tourism, of course, immediately comes to mind. But there are, other activities, BPO activities, for example, people who own businesses here and have to come. All kinds of issues could emerge. And then, it would raise the question, why are you preventing unvaccinated people from coming into Jamaica when only 5% of your population is fully vaccinated? You see, so before we even contemplate that, what we first have to do is to get our vaccination levels way up. And that is what we are on the ground doing.
We can address the CDC listing of Jamaica on the high-risk COVID implication.
It would not have been the first. It would obviously, there would be some implication, but we haven't seen any implications yet. For us, it's just motivation to get off that list very quickly. So, which is why we need to get our vaccination levels up, ensure, as I'm seeing everyone here, is properly masked and followed. The government will give a definitive position as to what is the policy of the government as it relates to vaccination. What we have said definitively is that we are not at this point to consider making vaccinations compulsory, meaning that you have to take the vaccine in the same way that we have, compulsory vaccination for children and to be able to attend school and so forth. Our constitution would require that that there is a threat, a danger that would justify the abrogation, any interference with the rights of the citizen. And yes, I am of the view, and I'm certain that MP here, who is an attorney, will be of the view, that the current health situation does give strong justification that we should give a directive for vaccination to be taken. But our constitution and the spirit of our constitution and our laws also require us to have a period of public education where the citizen is engaged. In other words, we would have to demonstrate that we have gone all the, as you have put it in legal terms, remedies, but that we have done everything else other than a mandate, right, to get people to vaccinate, so that we are not just jumping over the rights of the people, right, without them being properly informed as to why it is being done.
We will continue tomorrow in the constituency of the leader of the opposition, Mark Bowling, tomorrow. On Friday, the Prime Minister will have a blitz in his constituency, and the next corporate area blitz, as a part of the community blitz, will be in MP Philip Galway's constituency. So we are covering the corporate area, and then in the other days to come, the Prime Minister will be moving out into the parishes of St. Anne and St. Mary over the next couple of weeks.